Okay, can someone hazard a guess what this diagnosis is? So, can someone hazard a guess?
Neurofibromatosis.
Oh, correct. So, what three things can this patient have? Three abnormalities that this patient can have? One, they could have, which is what you are seeing now. They will have a lot of nodules, which is what they are seeing, right? You will see what's called cafe spots. So you can say it's sticky skin because acanthosis nigricans. So what is the treatment of choice for this patient? You just what is the treatment of choice for this patient? Can someone hazard a guess? Okay, now this is a very dicey question. Now the answer will be this, that the treatment of choice is observation. However, when a nodule is causing problem vis-a-vis is obstructing an important organ, is becoming painful, or it's affecting function, then you have to go and remove it. And treatment, there will be surgical excision. So if you say surgical excision, you will not be wrong. If you say that expectant management until complication occurs, then surgical excision, you'll be perfectly right. What are the diagnostic criteria that before we go there, what are the possible complications that this individual can have? Okay, please, I need, like I said, it's pure, this is interactive, so I need us to contribute.
Complications.
Yeah.
Low self-esteem, cosmetics,
Okay.
cosmetic,
Okay.
depression, skin ulcers.
Okay, you're right too. You're not wrong, you're right. But those are secondary complications, you're 100% right. However, specific to this disease that this patient may have, you see these nodules, all of them, they could become malignant, so they could undergo malignant transformation. So all these nodules, at the end of they can just change and become cancer. So one of the complications is malignant transformation, right? Another thing is that these people, some of them usually have hypertension as a complication. Then this depression we talked about, true. Then another complication they may have is that there will be compression. They can have compression of vital structures, such as the esophagus, and they start having difficulty swallowing, difficulty breathing. If it compresses because this node you are seeing in the skin, some of them also occur internally in the organs, in the body rather. And if this compress the trachea, if this occurring around the trachea can compress the trachea, you may have respiration difficulty. If it's occurring around the esophagus, it may compress the esophagus, the patient may have difficulty swallowing. If it occurs around the forehead, it can grow and cover the eye, the patient may have visual disturbance. Of course, low self-esteem is a complication, depression is a complication. So what are the diagnostic criteria? Okay, presence of 2 or more of any of these 7 features will make a diagnosis. You make a diagnosis of neurofibromatosis type 1.
So please come again, please. Presence of what?
Any 2 of the 7 features I will list now.
Okay.
any two you find will make a diagnosis of neurofibromatosis. One, first degree relative with this condition, right? That's one. Secondly, when you see 6 or more cafe au lait spots are usually macros, hypopigmented macros. When you see 6 or more in the individual, then you should be taking neurofibromatosis. For adults, the diameter is usually about 15 millimeter or more. For children, it's about 5 millimeter or more of the cafe au lait spot. When you see at least 6 of them, you should make a diagnosis of neurofibromatosis should be coming to one's mind. Again, I say first degree relative cafe au lait spot is one feature. If you look at the eyes, the slit lamp, and you see leash nodules, it's one feature that will tell you, okay, you're dealing with neurofibromatosis. Then again, if you see this multiple neurofibroma, multiple is one feature again. Or if you see one large plexiform neurofibroma is another feature, right? That's, I've mentioned about 4 or 5 and 4. Then if you do an X-ray of the skull, you may see sphenoidal dysplasia. The sphenoid bone is not well formed. That's another feature you check for. Then you could see acanthosis skin changes such as acanthosis nigricans. That's 6 of it. Then you could see long bone dysplasias. These are the 7 features. So any 2 of them make a diagnosis of neurofibromatosis. Type 1. For type 2, make a diagnosis of neurofibromatosis type 2. It's any 2 of the following. 1, found first degree relative with neurofibromatosis. That's 1. Presence of a plexiform neurofibroma. That's 2. And a CT, and if and either a CT scan, MRI, or whatever, or X-ray, or that CT scan or MRI finding of a schwannoma. Then when there are other tumors like gliomas in the head, in the brain, one can make a diagnosis. With all these, two of any of these will make a diagnosis of neurofibromatosis type 2. So commonly for the type 2, they usually may not have multiple nodes, like they may have maybe 1 or 2, or they may not even have, or they may have hearing problem. So that hearing problem will make you want to go and do a CT scan. Then that CT scan you do will then make you, that's CT scan you do, you may not see a schwannoma in the brain, that's in the skull. That can give you that can help you get a diagnosis. Are we together? Is there any question anyone want to ask me?
No, sir.
So we can progress to the next, right?
Yes, sir.
Okay.